And we're just gonna get started. We're gonna get started in just a moment.
One second, I don't know what's happening.
Thank you so much for being here. We're gonna get started in just a minute. Okay, everyone, thank you so much for being here. I want to welcome you, and I hope you've all had a powerful Women's History Month. I want to thank you so much for joining us today. Our briefing today is about the Urvashi VAD LGBTQ plus Women's Community Survey. Many of you know that this groundbreaking survey is housed at NCLR, but today we're going to spend some time talking about it in detail that we haven't done yet. So we're going to dig into what's in the survey, who we surveyed, and what that looks like. We're going to talk about what the survey has taught us about LGBTQ plus women, what we're doing well, and the areas that we are under-resourced and need support. And then finally, we're going to talk about some of the amazing things that have been made possible because of the incredible activism in our community related to this survey. And then it's going to be our hope that you are able to take this and use this data to create change into your community as well. Someone from our team, if you could drop the link into the Q&A so folks can have a chance to review and look through the report, I'd appreciate that. And as always, you'll have a chance to ask us any questions in the Q&A. You can do that right now, and you can do that throughout the briefing. We'll either answer you directly as we're speaking, if we see them coming through, or we can write a response in the chat for you. And then finally, if we don't get to them, we'll have a Q&A session at the end, and then we'll go through all those questions as well. So thank you so much, everyone, for being here, and we're going to get started. To get started, I'm going to provide some context for us. And this is something that we all know, but we are in the most hostile federal environment towards LGBTQ people in decades. Executive orders, agency rollbacks, and political appointments have intentionally and systematically dismantled LGBTQ inclusive federal health infrastructure that advocates have spent years building. The federal agencies that once collected data on LGBTQ health have been directed to stop. Non-discrimination protections in healthcare settings that NCLR fought hard to establish are now being rolled back. The legal floor that protected queer women patients from provider discrimination is lower today than it was even 2 years ago. And federal funding for LGBTQ affirming health research has been threatened or cut entirely. And this means that the already sparse research is actively shrinking. This is why privately funded work like this survey is not just valuable, it's necessary. This survey, like so many things in our community, came together when a group of activists concerned with queer and trans women's ability to shape our own lives, our health, and our families came together and made a path possible for us. Among these incredible leaders was the late and great Urvashi VAD, who bears the name of this survey, as well as Dr. Jaime Grant, who's with us today on this panel. But this survey was built by a village, a dream team of LGBTQ plus activists, researchers, advocates, and over 150 organizational partners and thousands of participants to create the first comprehensive national study on the lives of LGBTQ plus women who make their emotional, sexual, social, and or familiar lives with women. This survey represents the largest and most inclusive survey of its kind. One of the things that I love most about our community is that we don't wait. We've never waited for institutions to decide if we matter. This survey and this organization is a perfect example of that, and it couldn't come at a more important and critical time. Queer women are among the most understudied population in health research. Federal funding rarely reaches our community specifically, and the data that does exist is sparse and it's scattered and it is increasingly under threat. And yet the barriers that queer women face in accessing care is documented in the lives of women in this community every single day. The assumptions of heterosexuality, the lack of provider training about who we are and what we need, the insurance gaps and financial barriers to care, and the outright discrimination that keeps people from walking through the doctor's doors at all. What this survey does is gives us evidence. It's evidence specific to LGBTQ women. Because we know that when surveys disproportionately leave people out, it is often the same folks. It's women, it's trans and non-binary people, it's people of color, it's people with disabilities, it's people from all underrepresented identities. And if you are someone like me and you fall into those, that means that they never took your needs into consideration anyway. And so the solutions, it's not just that they don't work for you, it's that they can't work for you because they weren't designed for you. So when a survey like this exists that includes more of us, it's brand new data and it's showing what affects us. And this means that sometimes it shows us things that are harder to hear than we expected. This survey tells us the rates of trauma of LGBTQ plus women are not just elevated, they are significantly higher. It also provides context for other data in our community. For instance, in 2024, the Harvard Nurses Study released a first report of the life expectancy of lesbian and bisexual women in their survey. In this study, we received confirmation of what we've known or suspected, and that is that lesbian and bisexual women live significantly shorter lives than our non-LGBTQ peers, 25% shorter, in fact. The Urvashi Vaid Community Survey is a treasure trove of data. The survey was composed by over 170 responses, and it was completed by over 5,000 LGBTQ plus women. This is a very, very long survey where participants shared their experiences of love, of work, of family, discrimination, their social and political life, their health, their sexuality. And all of this incredible data tells the story of the trauma we face and the story of our shortened lives. And so it gives us incredible context to see the layers of structural violence and discrimination and the weathering of LGBTQ women's bodies and spirits over a lifetime. And in the aftermath of Urvashi's untimely death, this continues to give us so much, and they continue to give us so much. We now have this resource, a 360-degree view of the rich lives that LGBTQ plus women live, and not just what we're up against, but how we thrive in the face of structural intimate abuses. On that note, I'd also like to give a shout out to Irv's sister, Jatsna Vaid, who's done so much to further Irv's legacy. Thank you so much. And Irv also left an amazing team of leaders that are continuing to further this work. And we have many of them here on this panel today, including Dr. Jaime Grant, as well as Amelie Zurn-Galinsky, a queer health advocate and organizer, and Daunasia Yancey, who is the deputy in the mayor's office of LGBT advancement in Boston. So we're going to get started with Jaime and Amelie, who are going to talk about this survey data and telling us what's driving our early deaths and also telling us what's saving us. And then Daunasia will find the key findings in the study about how we get towards LGBTQ health and vitality and what the 5,000 women in this survey is telling us about how we thrive. And that said, Jaime, I'm going to turn the floor to you. So if you could just start and cover some of the demographics that the respondents had in the data collection process.
Thank you so much, Imani, for that terrific introduction to the study. If we could hit the next slide, we could start looking at the demographics. Next. One more. There's hey, Irving. I was there for that. Okay, who is in this study and who's it for and about? You had to be over 18, live in the US, and we invited anyone who has or does identify as a woman to take the study and centers LGBTQ women in their emotional, social, sexual, or familial lives. Next. So a portrait of our responders in terms of their sexual orientation and gender identity. 56% identified as lesbian and gay, and then 16% queer, 15 bi, 6 pan, and 3 asexual. And the really great thing about having 5,000 respondents is that the queer, bi, and pan number actually adds up to 1,850 people together. And given that there's so little research on queer, bi, and pan women, this treasure trove of 170 questions answered by those folks is a massive, massive database for our community and future researchers. Then if you look at gender identity and expression, 52% identified as femme. And I think this is the biggest lesbian, bi, queer, femme identified sample maybe ever collected. It's kind of incredible. And then 15% butcher masculine, which again, that's 750 butcher mask people. And then 14% non-binary or androgynous, and 8 genderqueer. So if you put them together, it's 1,100 non-binary or androgynous, fluid, or genderqueer people, which again, massive, massive treasure trove. Next. Gender and sexuality. We gave people a button to push if they said their gender was complex, and 32% of people in the study said they had a fluid or changing gender expression over the course of their lifespan, and 24% said they had a fluid or changing gender expression. We feel that this particular finding flies in the face of the idea that, LG is sort of very stable and everybody else has something fluid, right? There's such large numbers of fluidity in the sample that we can see it across LGBTQ identities. Next. Respondents in the study, you can see age across the spectrum. What's the number? Over 50 in the sample is quite big. It's over 1,000 people. And again, for researchers who are looking at aging populations, a very significant sample, but also, really good sizes in the middle and early years of life as well. Next. Participants were 73% white, specifically, not any other identity, and 27% BIPOC. This also gives us some really big samples when you drill down into specific communities. There are over 450 Black respondents, for instance, over 370 Latinx respondents, 275 API for communities looking specifically at changes and disparities and experiences within communities. There's a lot here for researchers to drill down. We also had a great spread across geography, and you can see 25% in the South. It's so hard to get large samples in the South, and we have an excellent sample here along with West, Midwest, and Northeast. Next. Income distribution. Over 30% of our respondents make under $50,000 a year. This skews a little, our income distribution is a little high, as community samples are often a little high on this relative to the general population. But again, it gives us a very large sample of people who are making under $50,000 a year. Also interesting is that 35% of the sample identifies as having grown up poor or working class, which is another really interesting thing for researchers to be able to look at in the study. Next. Amelie, take it away.
Thank you, Jaime. Our LGBTQ women are deeply impacted by trauma. 66%, a staggeringly high number of trauma survivors, have sought treatment for trauma. And we know that our actual number of trauma survivors is a lot higher. 76% of our respondents have experienced traumatic violence, including but not limited to sexual harassment, 52%, physical assault, 31%, rape, 27%. In contrast, it is stated that 10 to 13% of women in the general population experience trauma at some point in their life. Many of our respondents are grappling with disability. 50% of our survey sample had a disability. And in the number of BIPOC women, this is a higher number. 54% of BIPOC women reported living with a disability. 33% overall report that this is a mental health disability. That was the most common disability cited in the study. Despite these high numbers, more than 50% of our survey sample have never sought any accommodations and/or government benefits. 40% of disabled women in the sample found both mainstream and even LGBTQ plus services inaccessible given their disabilities. 51% of our sample are struggling with depression and 44% have anxiety. This is almost double the rate of the general population. National statistics on women report that 10 to 24% of women experience depression in any given year. 37% report a lifetime experience of depression. Anxiety is impacting 23% of women in the general population. So we have high numbers of depression and high numbers of anxiety. 47% of our sample experienced intimate partner violence. This alarming statistic is much higher than women in the general population. 33% of women in the United States report interpersonal violence in their relationships. Respondents also had lower rates of access to primary care than women in the general population. 20% lower rates of access. This is a huge vulnerability for LGBTQ plus women. And the rates of not having a primary care provider are even lower for our poor, BIPOC, trans, and gender fluid people in the study. These are the key drivers of discrimination and abuse in healthcare settings and in the broader world, according to our respondents. They know why they're being targeted and they know how that's affecting their health. Sexism, 38%, racism, 34%, anti-LGBTQ animus, 26%, and fat phobia, 18%. These are key drivers of their discrimination and abuse. There's good news. Next, what's saving us? But what is saving us? As institutions fail us, friends are our number one resource in times of crisis. Respondents resoundingly told us that it is their friends and community connections that help them get health care and attend to their needs. They affirm and support us as we face a world where toxic social exposure is threatening to shorten our lives. For example, in our sample, 57% of respondents told us that their friends helped us most to get out of dangerous situations when they were in interpersonal violent relationships. In fact, 2,000 of our folks who reported interpersonal violence, 54% found that police did not help them at all. While community-based LGBT plus care was highly rated and very helpful. So when LGBTQ women turn to institutions for help, it is our community-devised spaces that are helping us the most. And I wanted to talk about cultural competence and cultural congruency. Over the past 40 years, we spent a lot of time and energy and resources training our mainstream healthcare providers to be more culturally competent. I have to say this is very important and certainly allows more of our LGBTQ plus women folks to find providers who can serve them. But far and away, it is cultural congruency, connecting with our own community members in LGBT community-created health settings that is truly what saves us and keeps us healthy. This data gives us exactly what we need to know to improve access to primary health care and ways to create better health outcomes for LGBTQ women. Through the voices of our 5,000 women answering the survey, we are hearing about what kinds of environments make us access care and help us feel safe and to find healing. Daunasia, tell us more about what's saving us.
Thank you, Amelie. So yes, what is saving us? Some of the key resiliency findings in the study do center on sex and pleasure. We love our bodies and we love our partners' bodies. Respondents are reporting that their sexuality gives them a great deal of pleasure. And it's notable that when answering questions about frequency of sex, respondents are having more sex than women in the general population. This is such an important counterpoint to some of the data on key drivers of abuse that despite suffering under sexism, racism, queer and transphobia, fat oppression, women in our study are insisting on and finding pleasure in their queer lusts and their queer relationships. The final of our 170 survey questions was, what are your 3 favorite things about being an LGBTQ plus woman? 5,002 women wrote in their 3 favorite things. And what's in the 15,000 favorite things and the sex and friendship data, it gives us a framework for the LGBTQ plus women's health and effective, impactful health practices and services. Next slide, please. The 15,000 favorite things about being an LGBTQ plus woman and their responses fell into these core categories. Freedom to create ourselves, especially self-determination around our bodies and our genders and our sexualities, as we saw in the data. Freedom from patriarchal constraints and familial and societal expectations, especially but not limited to freedom from men. Freedom to fully embody queerness as a strategy of resistance, so connecting our own personal experiences to global solidarity. Freedom to embrace our desire, our pleasure, and laughter, especially in our love and lust for women. Freedom to revel in the joy of queer family and community. Feeling seen and known, especially within the liberating context of queer friendship and love, was really important to this population. Freedom to relax and grow into ourselves, to be, including but not included, not limited to being out. And this data is an unprecedented gathering of testimony about how pleasure, connection, community, and joy in our queerness creates a sense of freedom and resistance to oppressive systems. This is crucial evidence towards understanding foundational aspects of LGBTQ plus women's health as we create pathways to accessible and effective health services for LGBTQ plus women. And back to you, Imani.
Daunasia, thank you so much. So in just a few moments, we are going to turn to some of your questions in the chat. So if there are things that you're thinking about, feel free to start writing that in the Q&A function. But first, I want to talk about how these findings are already creating new pathways for LGBTQ women's health, and we are already having some really incredible wins. So first, I want to call on Dr. Carol Ketchum, who's organizing in Coachella Valley, where they've used this data to secure $3 million for a new LGBTQ plus women's health facility.
Thank you, Imani. Thanks to all of you. I'm honored to be in all of your company and so excited to be among you that started this survey that is really already improving the lives of queer identified women here in the Coachella Valley. If you don't know the Coachella Valley, this is the area around Palm Springs. Palm Springs is kind of the center of Coachella Valley, and it's a special area because it's very queer, and it's much more even in terms of, than people think in terms of gender these days. But one of the happy ending, or the happy beginning actually, that I get to share with you is in regard to a clinic that existed back during the horrible days of HIV and AIDS. It was called the Desert AIDS Project, and now that clinic is called DAP Health. So they already have a very strong and beautiful connection to the LGBTQ plus community. There was kind of all these synchronicities, as is often the case with activism and change, right around when the NCLR data came out. We in the Coachella Valley had identified the fact that when it came to lesbian and queer women's health, cis and trans, that we had a problem here in the Valley. The men could go to DAP Health and they could pretty much rely on culturally competent care, but there was not a place for cis, trans, queer women and lesbians to go, and there were some pretty bad experiences out there. So I'm kind of living here and over by my university and going back and forth, but was approached to put together a survey, which is what we did. And then the NCLR numbers came out as we were putting together our survey. So we had a group of really smart, diverse women that came together called the Coachella Valley Lesbian Queer Women's Health Committee, which is a mouthful. And we started putting together our own survey. We sent it out. We were inspired by the survey that NCLR is caretaking. We were inspired by that survey in many ways, and we modeled some of our questions on the survey. I love the joy in that survey, as I have said to Jaime at the Lesbian Lives Conference. You know, when I read this survey and the data, I thought, this is a project that only could have been written by a woman who truly loves women. That, I mean, it's just so beautifully done. It is a gorgeous, it waxes poetic at moments. And so we wanted to have some of that same aesthetic, and of course all these smart questions in this smart woman-centered approach in our survey. Our survey is much smaller. We can't account for how successful we were in terms of sample size, because we do not know how many women are out here. We ended up with about 320 complete survey responses. We think that's really good. It's a lot more than what we thought we were going to get. A very diverse sample. A lot of the same sorts of questions, but the questions, I mean, I could talk about this for days, but for the purposes of this webinar, the questions that were the most meaningful in terms of us taking this data and advocating for a clinic to address our needs as a community were the qualitative comments that we garnered, and then the data that our study corroborated that came out of the study that NCLR has done. So we went with this data, and it just so happened, another synchronicity, that DAP Health was writing their next 3-year strategic plan when we had this data. So we had our data, we had the data from Jaime and Irv. We came to DAP and to their strategic planning committee and gave them this data. We wrote our own report. And, you know, a lot of, again, it's a special place. A lot of the guys on the DAP Strategic Planning Committee were men who arrived in this desert because they came here with their husbands and their lovers. So their lovers and their husbands could be someplace where people would touch them when they were dying of HIV and AIDS. Because remember that. Ambulances wouldn't even pick them up. So that's how they ended up being out here. So they're already in this with their whole hearts. And when they read the data, I got to tell you, it was heartening. They were horrified. They were truly horrified. And they took our recommendations and they wrote it into the 3-year strategic plan. And that plan includes a women's clinic that has special cultural competency and clinicians that are specific to the needs of our community, as they came out in the NCLR study and as they came out in the qualitative comments in our local survey. We are up to just over $3 million in fundraising. We still have about $1 million to go, but we are moving in that direction in a way that you wouldn't believe. And the other thing I just have to say is that because out here in Palm Springs, and I know this is true everywhere, but in this valley, it's the older white male couples that have a lot of money. And what we have found is going to them with this story and reminding them who was there back in those days for you. Reminding them of that. They have been incredibly responsive, and they really get it. And so we just had a gathering in honor of women, and it was a gathering of the major donors at this FQHC. DAP is also a federally qualified healthcare center. That's also important. It's not private. It's federally qualified. And they came together and told stories about the women that they loved and then donated to the clinic. So I think there's a kind of magic happening that began with the magic of this beautiful, beautiful survey. And I just am, again, really grateful to be among you. And thank you for this beautiful work, every one of you. Thank you.
Carol, thank you so much. And thank you for your incredible work. Next, we're going to move to Savi, who's at the LA LGBT Center, who served as the data expert on the health report on the survey. Savi also works for the National Institute on LGBTQ intimate partner violence, and they can say a word about how the data is helping them discover and disseminate new emergency protocols that are best suited for LGBTQ women. Savi, please.
Thank you, Imani. It's so wonderful to hear from everybody. I think before I get too deep in the specifics, as a data nerd, I do want to really name the power of this survey, as everybody else is speaking on. I like to give this comparison example. There's a very large CDC data about intimate partner violence. It's one of the largest reports out there about intimate partner violence, and it has some of the largest data about LGBTQ IPV. This report has 25,000 respondents, and of those 25,000 respondents, it only has 51 transgender people. So I say that to say that, one, that is not actually what's happening. There's probably a lot more transgender people who are existing in that data. However, their gender categories that they had listed was male, female, transgender. So because of those limitations, they were not able to accurately capture the nuance and power and capacity of the population. And so the population was not speaking because they did not feel heard or seen. So I say that to say that this data is so important because it sees us and it values us and it gives us voice. Some of the projects that we are working on now to promote more about this data and talk more about it, I'm working very closely right now with Dr. Grant, which I'm very grateful for that. And we're creating two different projects from this data. The first one is a larger white paper type report. This is primarily going to go towards service providers, specifically about intimate partner violence, and going to go towards education for domestic violence service providers and LGBTQ service providers who are working with survivors. This report talks a lot about institutional interventions and how institutions can better support LGBTQ survivors. And as we saw in the data, a lot of that is understanding the strength of community and understanding that there are already these strong existing models of care. So how can we understand those models? How can we support them? How can we uplift them? And how can we educate institutions to better understand these dynamics that are already at play so that folks can feel safe in their natural environments? And we also, as I am a community researcher, so we are also creating a community project. This is going to be a zine. We're very excited about this one. We just started on this project. And this will be for the people, by the people. And it's going to be a lot more intimate, a lot more friendly, less formal, and talking about these existing models and how can we support each other? What does that look like in practice? What questions we can know about how to ask, who we can feel safe with, how we can strengthen these models. Because again, this is already happening. This has already been happening. So how can we do this in ways that feel good and feel better? And how can we do this with the institution, with these spaces, with domestic violence agencies, and on our own? I don't think it necessarily has to be one or the other, because this is all going to exist. So how can we strengthen all the models to support each other, and folks can go where they feel freest and where they feel the best support? And hopefully throughout time, that means that folks can walk into a domestic violence agency and get support from a survivor advocate who is going to help them find long-term housing. And that long-term housing might be supported by short-term housing from a friend or community member or chosen family. Or they can go straight to their friend who has these resources and have this awareness of how they can help them and build safety and get away from the harm that they have historically been experiencing. So many powerful projects. And honestly, this is just the beginning.
Savi, thank you so much, and thank you for your incredible work. We're so grateful for you. So now we are going to move to the Q&A portion. So if there are questions that you've been sitting on, please go ahead and drop those in the chat, and we'll get started on some of the ones that we're starting now. A couple people have asked to provide the link again for the document. If someone behind the scenes, if you wouldn't mind linking that, we'd really appreciate it. Thank you so much. And then when this goes out too, we can find a way to link this to the video. That's another question that this video will go out to folks that attended, and then also we'll be posting it online on our YouTube account, so you can find it there. Today's Thursday, you can find it there by early next week. Oh, let's see, we have someone that's typing a question now. Let's see. Savi, this one's for you. So the question is, yes to poetry of research on complex women's lives. How did you define intimate partner violence? Did you analyze data on transmasculine folks separately? As a public health professional and cultural competency trainer since the 80s, I appreciate this project. Discussion on cultural congruence and institutional supports and the positive impact, including the zine.
Yeah, I can definitely start with this question, and Jaime, feel free to build off of my answer. Well, to start to say how we're defining intimate partner violence, there's so many definitions happening for intimate partner violence, and what I think is very important as a community researcher is finding the language that is most accessible to people and is inclusive of different types of violence, because intimate partner violence, I include domestic violence, I include community violence, I include, and when we say domestic violence, that could be from any member of the family. I also try to talk more and more about hate crimes, because I do think that is a part of this conversation that especially impacts BIPOC folks, especially a lot of Black trans folks. So wanting to make sure that this is an environment that we are inclusive. So when I talk about violence, I am using very broad definitions. And then when I'm working with either specific populations or specific institutions, or even just specific grant deliverables, right? Then we might have to give a really specific definition, but providing nuance and information for community members of what this is meaning for them specifically. And trans mass people are very much represented in this survey. We have a category that is for those who are fluid, and we have categories for those who are masked. And so folks who are masked, that also including trans masked people. There are specific ways that we can dig out that intersection, and we are able to do that in certain moments of this survey, which is really great. And anybody who's kind of deeper in the data trenches know it's such a creative out of the box thinking that you have to do. And it really depends on the question, because some questions, there's more answers from certain populations. So we are able to pull out that data. And another thing that Jaime and I had to discuss often within this survey is traditional academic research often requires a large number of participants before they will even offer results. And so, for example, you need at least 100 or 1,000 people to answer this question before we can share results of what this answer is. Me and Jaime were really trying to give the results out there and be as public and transparent as possible. So that meant sharing the results, sharing the information that was being presented, and naming really transparently that this, we cannot give causality, we cannot name correlations necessarily, but this is the information we have, this is the numbers that we have. And that was as to empower people to get as much information as possible. But I'll pause there and let Jaime continue.
Thank you so much. I love the way you're talking about how expansive our approach is. But I do want to say there are 193 trans mask identified people in the study to look at around their experiences of violence. And there are layers and layers of questions on experiences of violence, such as hate crimes, theft, experiences of people in your immediate environment having been murdered. There's a lot of different ways to look at violence in the study. But in terms of IPV, we just ask people to self-identify. Have these things happened to you? Has someone been emotionally abusive to you? And then a series of questions, has someone been physically abusive to you? So we really looked at trying to help people testify about their experiences and then grouped those experiences into buckets. And all of that work is there for future resources to take those samples and look more closely and do deeper dives into what we see. So I hope that's also helpful.
Thank you. So we also have a question. I'm part of an advisory committee that's working with Spectrum Health in Phoenix to help shape a new offering for LGBTQ women's health. Would it be possible to have someone from the study meet with this group and talk specifically the health and medical about the health and medical aspects? They're specifically interested, highly sensitive to addressing the underinsured lesbian population and ensuring our services can work with them. Jaime, I see you nodding. Do you want to type your anything to say, or you can just type your email in the.
Yes, I'll type my email. I just want to say we're excited to be working with any partners who can, think this data can give them some support in their local organizing. That's our dream.
Yeah, I think our dream is really to help people shape what's happening in their communities and to use the numbers nationally. And sort of Carol's example is a beautiful one, to use even some of the questions to say what's happening in your community, to tailor it so you can start to create things that are attuned to what's happening in your community. Absolutely.
Let's see. Someone's asking about translating. Is the report in any other language? They're asking about Spanish in particular.
It is not yet. I would say we've done the report on fumes. I would love to have some help and support if people know where we can go to do translation of findings, especially the executive summary. Also, though, we did have the survey itself was offered in Spanish, so some people did answer it in Spanish.
Okay, I think we've gotten through the questions. Are there any last questions before we sign off? I'll look through it one more time. Jaime, go ahead.
Well, I could just say a little bit more about Savi and I working together on these IPV questions. I mean, one of the things we found, which I think is really significant, is that LGBTQ women are experiencing, first and foremost, at the highest rates, friendship disruption, isolation, and gaslighting. And so a lot of the current ER interventions, for instance, right now will say, are you safe at home? And your average LGBTQ woman is going to answer yes, even if they are being lied to the point of, confusion and being driven nearly crazy, right? Or they are isolated because their friendships have been disrupted by an abusive partner. So actually finding ER and other first responder interventions based on the data for the study, the things that I'm thinking about are a first responder asking us, is there a friend I can call for you? And if the answer is no, digging deeper about what's going on in their friendship network. And this is the type of thing that's completely invisible to basic ER personnel at this point. And I think a really significant intervention we can start to make around community education for what's going to help people identify that huge 47% that, again, people just are not aware of what we're going through. And also in the bi and pan data, bi and pan women are experiencing more physical violence and accessing LGBTQ services less often. That's something for us to bring to our LGBTQ community devised spaces. Why is that? What should we be doing? So these are the kind of specifics that are coming out of the study that are pointing ways for us to really develop new interventions and practices.
So I'm finding, thank you so much. I'm seeing these other questions coming in too. So first is, thank you so much for all this awesome work. Since the current political climate is clearly anti-women, anti-trans, do you have solutions or examples of how we can best uplift this information, get it and use, monetize, get funded, and increase our stakeholders' knowledge base?
I would just say, I got into this work before the government gave two hoots about us, knew anything about us, funded anything. And, our community-based networks, the ways we've created community communication networks, how we've always educated ourselves and each other, how we created this study. Nobody was interested in this. When Urvashi and I started fundraising, everybody just yawned at us like, oh, LGBTQ women, aren't you okay? I mean, is there really something to look at there? That came from people who, supposedly were our allies and the good guys, never mind the bad guys. So, I think we have a strong tradition of building our own community byways and ways of educating each other. And we're going to have to be incredibly creative in this period because all the money's getting sucked out of everything.
Thank you so much.
If I can jump in here too,
Yes.
I think the other thing is we know what we know and we know what we need. That comes from the disability justice community. And I think the same is true for our LGBTQ plus women's community is we already know what's going on and we know what we need. We just need to keep talking to each other and being creative. Yeah.
In terms of the funding, I just cannot stress what a powerful experience it was to have a little bit of our local data and then having that corroborate this huge national data set, right? And then to be able to go with data, because this is like the buzzword. Every institutional person in the world right now wants to do data-driven decisions. I get it, and we can provide that now because of the study, right? And then you combine that with, I'm thinking about the person that asked about a project they were working on in Phoenix. You combine this huge data set with just a little bit of local data. Bundle those things up together, and you've got a powerful presentation for local funding.
Excellent point. I'm wondering, Jaime, you might be the best person for this, but anyone feel free to answer. Someone's asking, do you see overlap or parallels to this survey and the national survey on trans people? Perhaps there's some reinforcing data for both populations, which of course overlap.
Well, I was the principal investigator on the first national trans survey in 2011. So yes, I would say so much of the, the ways we posed the question. So the way we looked at how to ask people to report on their gender and their sexuality, we really trailblazed that in the national trans studies. And also when we looked at what an incredible impact the national trans studies have had on policy gains and changing practices and changing perceptions, changing whole narratives. We realized, how do we not have national, data on LGBTQ women? It was kind of like, duh. So I definitely think there's a lot of parallel questions in these studies. And of course, there's 744 trans people in this survey. So there's a lot of places the data can work together. And, so many findings that people think of as LGBT women over here and trans people over here, as though those communities don't overlap and they're not all, the findings, and this study totally busts that binary that, TERFs and other people are really interested in. So I think super exciting to be able to take parallel questions and say, hey, same thing's going on over here. I think this is actually, one community, So, yeah, thanks.
Thank you. We have someone asking, do you have separate data for California residents?
Yeah, we ask everybody to put in a zip code. So we do not have the raw data set and code book ready for scholars to access yet to do their own data pulls and reports, but we will in the next 6 months. And so people in any residential area can come and put your zip codes in and find out, what your local data is out of the study. I would say we're about 6 months off from being able to offer that to scholars.
I just want to say I'm very excited about that, Jaime. Very excited. Please let me know as soon as it's available.
Wonderful. Someone says, amazing. Thank you all so much. How can the findings help inform programs, resources, or policies that better support LGBTQ plus parents and parents raising LGBTQ plus young people?
Wow, that's a great question. I have a whole chapter I want to write. There's many, many questions on parenting and how our kids are doing. And it's really incredible data. And it's really not data I want to put a chapter out on in this political environment. I would say, once we survive this era, there's so much we can do with it. And if I put it out now, it would really be used to kill us. So as someone who's raised two kids and have needed this data desperately to help support them and help them grow in the institutions that I'm facing with them, I understand what a terrible answer that is, right? That we actually need this data now. But I would really suggest waiting a bit before we come out with this really incredible data on ourselves as parents and the amazing, range of expressions in our kids and, and also just challenges, what we're facing as parents and what our kids are facing because of the hostile environments we're in.
I would just add to that. I think a piece of this as well that from this data is about access to medical care, access to safe and comfortable medical care, whether that's specifically with LGBTQ providers or providers that understand LGBTQ healthcare. And so I think a piece of this for parents, for LGBTQ parents or parents with LGBTQ youth, is around advocacy and how can we advocate in a very racist, sexist, homophobic, transphobic system, and how can we network with our community to find doctors and nurses that we feel safe with. And so again, I think it's coming back to community and it's like spreading the word and hearing from each other where we can go. But I think advocacy for our parents or for our youth or working together to find that advocacy is also a big piece of this.
I think this is the last one. As a non-binary femme in a women for women relationship, raising my daughter, how can the insights from this survey help my healthcare team better understand and meet my needs as I advocate for my own health and the health of my family?
Yeah, I mean, I am dying for a researcher to come in and really take on the, bi, pan, and gender fluid sample inside this sample and really go with it and do a full report because we are finding bi, pan, and fluid folks just about on every measure, whatever challenges people are facing, their challenges are higher. And I don't think that is really a clear understanding people have in our community. People tend to really understand the challenges and the abuse people who are on the binary end of being trans are facing. But people who spend their lives in the fluid spaces in our study, and I think this is true in the national trans studies now too, there's a much bigger percentage of people in those studies that are bi, pan, and fluid. And they're just facing so many challenges. Like the system is rigged for binaries. And those of us who don't fit into them are just coming up against barriers again and again. So it's one of my big hopes that we're going to, have more support, funding partners to create, specific reports on the bi work and non-binary folks. Thanks.
That was our last question. I want to thank everyone so much for joining us today, and I want to thank our incredible panel. And I also want to remind this group of folks that let's hold on to the fact that we have done this before. Long before we had legal protections, LGBTQ people built our own knowledge. We created our own informal networks of care, sharing information about affirming providers, warning each other about the hostile ones, and founding our own community health clinics. And we founded them from scratch. We did this because mainstream medicine had made it clear that they wouldn't serve us. We drove the community response to crises when the federal government looked away. We've always found ways to generate knowledge that we needed to survive and advocate for ourselves. And this survey sits squarely within that tradition. It's our community documenting our own experience when institutions won't do it for us. It's our self-knowledge as a civil rights tool. And that kind of knowledge, community generated, community owned, it's hard to dismiss and it's even harder to erase. And we need to remember that. And I want to close by just speaking to everyone directly on this call because you are not passive observers in this moment. You are part of it. When you support this work, you are participating in a tradition that goes back to the earliest days of our movement, a community that has always chosen knowledge and advocacy and solidarity over waiting for institutions to recognize our worth. This webinar, this survey, this organization, it's all a reflection of this community that refuses to be invisible, a community that has always known who we are. I want to thank you all for supporting this work, and thank you again for our fabulous, fabulous panelists. You can learn more about the Urvashi Vaid LGBTQ+ Women's Community Survey at nclrights.org. Thank you again, everyone, for joining, and take good care of yourselves and of ourselves. Thanks.